Hello, my name is Stéphane from Clinique Santé Guindon in Lachine and Calgary, and today what I'll be talking to you about is the craniosacral rhythm. Craniosacral therapy, the reason why we do this is to normalize the hormonal system and the nervous system, especially the involuntary nervous system, the one that takes care of temperature regulation, digestion, and so on and so forth. The 5 principles of craniosacral therapy are as follows. Number 1 is glial cells. So when we treat the brain or the skull, for example, with craniosacral therapy, we have an effect on what we want to do is to stimulate the glial cells. The glial cells, that's what contracts and retracts. They are responsible for creating the craniosacral rhythm, as well as the number 2, which is the fluctuation of cerebrospinal fluid. Basically, your spinal cord and your brain basically is floating in cerebrospinal fluid, and that fluid is being produced and resorbed. The number 3 principle is the membranes of the spine and the membranes of the skull. And what it does is it breaks the system, or it allows it to go further. And these membranes, for example, is the dura mater, which is the outer layer of the brain and the spinal cord. At the same time, we have the tentorium cerebelli, which is a horizontal membrane, and there's the falx cerebri, which is inside the skull. It's a vertical membrane. The other one is the sutures. Every brain has sutures. If you look at a skull, for example, such as this one that I have right here, you can see on the skull that they are lines. And these lines, basically, that's what we can treat these lines and make sure that there is mobility. And any impact on your head from a blow, from a hit, can result in something like that. For example, at the occipitomastoid suture back here where my finger is, if you're involved in a car accident, in a whiplash where you are rear-ended, this suture can be blocked and cause severe headaches. Okay, and the final principle, number 5, is the sacrum, which is this triangular bone between the coccyx and the lower lumbar spine. That triangular bone has to be mobile within the 2 pelvic bone, the 2, like your pelvis, and that bone has to be mobile. So there are your 5 principles for craniosacral rhythm.